I think I think there's a couple of things. Sometimes one can do a very, very mild, what's called equilibration. It's a balancing, but it has to be done very skillfully. So you can actually see where the interferences are in the teeth. I've gone over this on some other videos on my freeholisticdentalcourse.com presentation. But the main thing that I see happening is Mother Nature developed our jaws so that when we rub side to side and front to back, mainly our front teeth catch almost immediately. So when we're rubbing and go forward, it deprograms the deep muscles that we clench with. If the back teeth are catching at the same time as the front teeth, in other words, if you rub side to side, anybody watching this could do their own exercise. If they can feel their side teeth rubbing while they're rubbing side to side and not just their front 6 teeth, top and bottom, then they would be more prone to clenching because those muscles don't shut off. Exactly. And they can do destructive forces on their teeth. And those are the ones that will be watching this. Go look in the mirror and you can see wear patterns on your front teeth, and your teeth, you'll find exactly where your habit is. You'll find where they fit together like a puzzle piece, and you'll be amazed, but that's where you're rubbing them typically at nighttime, and probably to open up that airway and maybe stimulate the cerebral spinal fluid.
Yeah, I always tell patients it's very important. And Paul brought up a great point about your occlusion, your bite. And if you have a malocclusion or bad bite, and you are, as he said, grinding in the back and not in the front, you're overstimulating muscles that they can't turn off. But I always tell patients that your eye teeth are the steering wheel of the car. And it's called canine guidance or canine protected occlusion. So if you do not have this canine guidance where the eye teeth actually allow the jaw to separate, so when you go to the side, you get this canine rise. And that's why it's important. I see a lot of dentists, you grind your teeth here, slap on a night guard, and now they have this plastic night guard. And the problem is that unless the occlusion is balanced, as Paul said, you're really treating the symptom and not the root cause.
Right. 100% agreed.
Okay. Should we have our wisdom teeth pulled? What are the pros and cons of that?
Jerry, you take that one.
You want me? Oh, I thought you were going to take that. So, again, my personal opinion is far too many wisdom teeth get extracted than need to be. I had a young patient today whose mother brought her, and her dentist said, "Time to get the wisdom teeth out, like it's a rite of passage." And I looked, and they were not only were they not even fully formed yet, of course, in a 12-year-old, they weren't fully formed, but at the same time, they looked like they had more than enough room to erupt normally. So this, you're bringing up a loaded question, Steve, which is why I think Paul and I probably, again, we are very aligned, and I feel like we're kindred spirits. Far too many wisdom teeth get extracted than need to be. Now, that's not to say that there are wisdom teeth that are malpositioned that are never going to erupt properly and could be causing problems with the rest of the dentition. So it really has to be looked at. And again, not to sound like a broken record, but a CBCT, a 3D scan, is really important to see get far more information than two-dimensional x-rays.
Oh, that's great. Yeah, because I know when I was back in the day in dental school, it was looked upon like this. The child 16 years old, 17 years old, the roots haven't really formed. That's the best time to take the wisdom teeth out, because within 10 years, they'll be married, have a family, the roots are down along the jawbone. It's much more difficult, more dangerous, etc. So just take them out. And I'm like Jerry, it's like, wow, I have a lot of patients with their wisdom teeth and they're in their 70s. And as long as they keep them clean and healthy, they do quite well. If there's room, if they're laid in at an angle against the teeth just in front of
horizontally impacted,
or horizontally impacted where it puts pressure or it can ruin the root of the tooth in front, then that's a good candidate to remove those. But they got to remove them properly. Otherwise, they're going to create a cavitation.
Exactly.
Okay.
The one other thing I wanted to say is, for those that are worried, oh, there isn't room for the wisdom teeth. Well, that's a perfect opportunity for expansion of
Right.
the jaw. And that's where there are devices for children now, like called MyoBrace and others, that help with the guided eruption of the teeth and the proper expansion and room for the teeth to erupt.
Right.
Should we get root canals?
Oh boy.
No. Easy one. No. A root canal at best, in an emergency situation where somebody fell and broke their tooth, that is, and a nerve is exposed. What's the emergence? Root canal is such a, it was modern root canal was introduced, and a lot of it right after World War II. And around late 1940s, a lot of work done at Boston University. And the concept was we saved the tooth. Well, like anything else dead in the human body, it's going to necrose, and it's going to produce endotoxins, which are bacteria and bacterial byproducts. And eventually it will dysregulate the immune system. So I never look at anything in the world of endodontics as more than temporary, because it's not a permanent solution, and it's going to bring on a lot of serious problems down the road. A sterile tooth that has a nerve taken out of it because it's exposed is at best a temporary procedure. A root canal on a tooth that's sitting in pus is a ridiculous choice. And you can end up trapping very serious pathogens that become really super pathogens down the road.
And Jerry, what are you finding? What's your thoughts on? Because I have some patients. I'm sort of in the middle road on this one sometimes, because some people would, let's just say, some people would rather die maybe earlier, if that was the case, than lose their teeth. So I sort of leave a little bit of flexibility there, but
Right.
if they do decide to have a root canal, at least I'm encouraging them to get the gentle wave procedure and the biolaser procedure, at least disinfecting it.
Right.
I've tried to get those companies to do a long-term study. They haven't yet, to see, will the bacteria still encroach from the periodontal side inward. I mean, it's one nice thing to clean out all the dentinal tubules. Those are all little side channels along the main canal of a root that can harbor bacteria, because traditional root canals, when they clean that little stringy piece out of the root called the nerve, they end up packing debris laterally, and they lock in these bacteria, which then mutate and become really toxin producing opportunistic bacteria, and they dump toxins out through the side of the tooth, down along the ligament along the side of the tooth, down into the bloodstream, etc. But I'm wondering, with the gentle wave and with the biolaser, if that's a long-term effective thing, because even the darn implants are showing some bacteria around them too. So it's like,
right.
wow, what a challenge.
Titanium metal implants are definitely produce endotoxins. So you have root canals and metal implants, both producing endotoxins, and really the only biologic choice that has many advantages is the zirconia implants. Unfortunately, a lot of dentists have trouble restoring those. There aren't many components for those. So the engineering part of being a dentist is very difficult with zirconia implants. They take longer to heal, but the bone that grows around ceramic implants, and I'm sure, Steve, you have some questions about that, so I don't want to jump ahead, but the bone that grows around ceramic implants is very different than titanium. Titanium is more like scar tissue bone, walling it off, sclerotic bone, whereas zirconium, ceramic zirconia, which is actually a white metal, but it's in the world of ceramics, you have vascular bone, bone with a blood supply. And again, like I said, it's really important. The lifeblood of the oral cavity is saliva. The lifeblood of the bone is blood.